Hi, welcome to our webinar, Healthcare, Hearing Loss, and Communication. My name is Lori Hannon, and I'm the Executive Director at the Center for Hearing and Communication. Before we get started, we just have a few logistical details to go over with all of our participants, and thank you for all being here. Today's webinar will be interpreted, and our sign language interpreters are Jamie Steinberg and Barbara Finks. Captioning is being provided and is available in two different ways. To see the captions on the Zoom page, if you don't already see them, simply click on CC at the bottom of the page and select Show Subtitles. If you prefer to view the captions in a separate browser, there's a stream text link in the chat currently that you can copy and paste into any browser that you choose. If you have any technical difficulties during the webinar, you can call Brenda Irizarry at 917-305-7702 or email her at birizarry@chchearing.org. And don't worry, this is also currently now all in the chat. After about 5 minutes, we are going to be closing the chat, but in the Q&A, you will be able to see the information about Brenda. Also, don't worry about writing down all of the apps and tools and resources that you'll hear that you may be interested in. We'll be sending a follow-up communication email after the webinar, and we'll have all of the information provided so that you can really sit back, enjoy this, and take in all of the information. We will be turning the chat box off so that it doesn't interfere with the captions. We'll take questions after both of our presenters finish presenting. Please just type your questions in the Q&A. We'll do our best to answer as many as possible. I'm delighted now to introduce our two speakers. Dr. Nancy Rennert is System Chief of Diabetes Care, Nuvance Health, Chief of Endocrinology and Diabetes, Norwalk Hospital, and Associate Clinical Professor of Medicine at Yale School of Medicine and the University of Vermont Larner College of Medicine. She has been recognized nationally for her work. As an adult, Dr. Rennert experienced sudden, profound bilateral deafness and now uses 2 cochlear implants. She's passionate about healthcare access, quality, and equity, and it's our privilege to have her here to share her insights both professionally and from her personal experience. Carolyn Stern, who I have the pleasure of working with every day, is the Assistant Director of Outreach and Strategic Initiatives at CHC. She's also a bilateral cochlear implant user and has helped countless others. I was going to say thousands, but maybe we're at hundreds, but close to thousands, recently hear and connect better with tips, technical information, and support. When the pandemic locked down New York City, Carolyn immediately pivoted all of our work to online outreach with blogs, webinars, and online group meetings. The purpose of this webinar is to provide information on how to navigate healthcare with a hearing loss during the COVID-19 pandemic. While having a hearing loss for many people has often added challenges to having effective communication during healthcare visits, the special circumstances surrounding these times has made it a particularly difficult situation. Over the past 6 months, we've heard from many of our clients and other consumers about how to communicate with anyone who's wearing a mask, and particularly how to manage important visits like medical visits. Quickly, we had conducted a webinar devoted specifically to managing hearing loss while people are wearing masks. But still today, 6 months later, we continue to receive questions about communication, about fears regarding safety in doctors' offices, how to access captioning for virtual visits, and more. And that is why we're here today to try to answer some of your questions and concerns about this topic. And now I'd like to turn this over to Dr. Rennert and to Carolyn. Dr. Rennert will start.
Thank you, Lori, for inviting me. I'm happy to be here, and welcome to everyone. So this evening, we're going to talk about navigating healthcare and communication with hearing loss in 2020 and beyond. I'm going to first describe recent changes in the healthcare environment that impact those of us with hearing loss, and I hope to provide some ideas and insights on how to optimize your healthcare experience. Then Carolyn Stern is going to take a deep dive into specific tools and technologies that you can use and discuss assistive devices for your hearing instruments, hearing aids, and cochlear implants. Then we're going to tie it up with some specific examples and leave time for some questions. It's a lot on the agenda, so as Lori said, don't worry about remembering or taking notes. The wonderful people at CHC will be sure to send follow-up emails with lots of details, additional references, as well as our contact information. I think you probably already know, having received multiple reminders for this webinar, they are really good at sending emails. So I also want to note my personal goal for this evening, and that is to share what I've learned and what I continue to learn from all perspectives. As a deaf physician who uses 2 cochlear implants, as a patient, and as the person who manages my family's health. I see it from all sides, and I live this every day. It has truly been a challenge on all fronts, and it's made me realize the importance of seeking help, persisting, and also trying to be flexible while everything around us changes. Knowing that everyone is different and individual healthcare situations are different, tonight we hope to provide a number of options, strategies, and practical tips to make it easier to take care of yourself and your family in these times and going forward. And to my colleagues in the health professions, many of you have registered for this webinar, thank you. Let's think about what we can do better to make it easier for people with hearing loss. I welcome your suggestions, your experience, and I ask that we commit by choosing to improve one thing so that we can better understand where you are as a group. We would like to do a short poll. There will be 2 questions, and I'm going to read the questions and ask you to respond. So if we could please have the poll. Okay, question number 1. Have you experienced communication difficulty in a recent medical visit? Yes, no, or I haven't had any recent healthcare visits. And by recent, let's just say about the last 6 months. So please go ahead and click your response. The second question, during a recent visit, and again, using that 6-month time frame, did your provider use any of the following? The first is a clear mask, and that would be something like this, or like this. That gives you a visual to see expressions and being able to lip read. Or a clear face shield, which would be something like this. Did they remove their mask? Did they write down information? Did they use a speech-to-text app? Or none of the above? So please click on your responses, and then in just a moment, we will see the group responses. Okay, maybe we'll give that another minute to see if we can get the responses. If not, we'll move on and we'll come back to it. Okay, here's our responses. So the vast majority, 70%, have experienced communication difficulty. And that's what we're going to talk about. But I guess the good news is that the majority, 92%, did have healthcare visits. So that's a good thing. But there's lots of opportunities for improvement. As for any of the accommodations, it looks like for most people, almost half, no accommodations. And then there's kind of a spread with perhaps the most common being removing their mask, and that obviously potentially puts both people at risk. So lots of opportunities here. Okay, so let's move on with the first slide, please. Okay, so I'm going to start where I think is the top of everyone's mind, safety. It could be by email, by patient portal, by a text, or by phone. You'll be asked if you have any symptoms of COVID, if you've had contact with or have a household member who tested positive for COVID, or if you've traveled to high-risk areas. If any of those are true, that's considered a positive screen, and the office will be in touch with you for next steps. And that may involve either postponing your visit or changing an in-person visit to a virtual visit. But the good news is that everybody who passes the screen and who is at the office has a negative screen. In addition to that, most places will check your temperature with a no-touch device upon entry. There is lots of cleaning, many protocols. All surfaces are being wiped repeatedly and in between patients. You will notice that exam rooms will have signs that say clean. And when you're brought into the room, the sign may be removed or turned around. You may notice new air filters. You may see that there's only one way to enter and a different way to exit, and other safety measures. You'll likely notice other changes in the way the office operates. There may be no waiting room. You may be asked to wait outside and receive a call or a text when it's your turn. Or there may be far fewer people than you're used to in the waiting room. Physical distancing will be maintained throughout your visit, except when it's related to an exam or procedure. There will be many fewer or no touch points. So for example, checking in and out may be touchless, and you may be asked to pay your copay either electronically or by phone. Masks will be required. I would encourage you that if you have any questions or concerns, don't just postpone your appointments. Please contact the office or hospital and ask your questions so that you'll have an opportunity to feel safe. Next slide, please. So our changing healthcare environment. So during the COVID pandemic, some non-essential surgeries and procedures were suspended. Offices for a time were closed, or we're seeing a reduced number of patients in person. And we rapidly shifted from in-person to virtual visits. I want to spend a minute talking about virtual visits, because I think that these can provide a unique opportunity for better communication with hearing loss. So I'm using the term virtual visit in a global way. It can also be called a televisit. There's many types. It could be by video, by a patient portal, using a secure website or an app on a smartphone, or even by telephone. But it's some way that allows you to connect with your medical team without being physically with them. So we're gonna talk about, when we go over some examples, how these virtual visits can be leveraged with visual and audio assistive devices, relay services, and other options to improve communication. I think one of the most difficult changes for people are the restrictions on visitors, family members, and in-person interpreters. And we're going to talk about ways to navigate that as well. So the use of face masks, face shields, and personal protective equipment in many cases will eliminate the ability to lip read or speech read. And clear masks may help with that, but all of these things will decrease sound, especially in the high frequencies, and that can affect your ability to understand speech. Stress, time, and financial pressures. I think we all know about stress. Healthcare professionals and staff are experiencing stress as well. There is a lot of time pressure because adding in all of the additional safety measures, we have to try to figure out what to do. Should we extend our hours? Should we add some virtual visits to our in-person visits? Clearly, we cannot see the same number of people in the same time. And a lot of practices and hospitals are facing financial difficulties, some of which is related to the pandemic. So overall, it's a lot for everyone, including healthcare workers. So here are some ideas to improve healthcare communication. So the way that I look at this is I separate out what I call system care from point of care. Now, system care is really important. These are the policies, the procedures, the laws, the regulatory issues. These are your rights that protect all of us and require that we are provided with appropriate communication. Point of care, I'm going to define as what's actually happening at the healthcare encounter in the moment. I am going to focus now on the point of care. I think there is a lot published on system care, and we're going to include references in the follow-up material. So I want to talk about actual healthcare visits and how to optimize things in the moment. So healthcare is a team sport. Like all teams, members have different roles, and we work together towards providing comprehensive care. So think beyond the doctor or clinician. There are other clinical team members, such as physicians associates, often called PAs, nurse practitioners, maybe they're called APRNs, various levels of nurses, RNs, LPNs, and medical assistants. There are also staff members that can help you. Front desk personnel, schedulers, often there'll be a practice manager, and sometimes even a patient navigator. So every team member is doing what they can to the limit of their training. So it may seem to you that other people are doing some of the things your provider used to do, but be reassured that there are frequent group check-ins with the doctor and clinician. Next, I'd like to talk about finding an ally, somebody in the office or the hospital who can help you with your communication issues, accommodations, and questions. Think about all the team members. And it's a good idea that when you schedule your appointment, you might ask who would be able to help you with those accommodations. So I want to take a broader view of the medical visit and look at it not just as one point in time, but look at it as a pre or before the visit and a post or after the visit. So pre-visits are becoming very common now due to COVID screening. And so often you'll be contacted before your visit. This is a great time to discuss your preferred communication strategies and technologies that you'd like to use, And our next speaker, Carolyn, is going to be going into a lot of detail on this with many, many options. So I recommend that you try to contact the office, if possible, about 2 weeks before your appointment and ask which team member can help you. You can also use the patient portal if that's available. And if you're not familiar with patient portals, I would encourage you to check it out. You can use these for many purposes. One is to message a provider or a member of the medical team. You can get your test results. Sometimes you can schedule appointments. It's a good thing to know about it. Also, when thinking about your before the visit, I think it's a good time to write down your medical questions and concerns. I think we've all had the experience of coming into a visit. It just seems to go fast, and especially if you're focused on using assistive devices or your communication, and then you realize you forgot something that's really important. So it's good to be prepared and have a list. And that brings me to the after visit or the post visit. And now, while pre-visits are becoming quite common, an after visit or post visit is less common, and you may need to ask for it. And that could sound something like this. I want to be sure I understood everything. Can I connect with someone later this week? I would suggest you specify what's going to work best for you. Would it be a video visit? Would it be using a relay system, whatever that is, as well as try to specify exactly what you're looking for. So maybe it's looking for further instructions on taking my medication, or what do I need to do to prepare for this test? I think the post-visit is something that we're now starting to utilize in my office. And it's another opportunity to touch base and ensure good communication. So even scheduling a virtual visit afterward can be very helpful. Next slide, please. Okay, so here's some tips. And this is my personal recommendation. At its core, communication is interaction with others. So here's what I suggest. Set the tone. Example, you're walking into a room, you see the sign that says the room is clean, and the person accompanying you takes the sign off and moves it because now you're going to enter the room and it's going to need to be cleaned again. It's a nice opportunity to say, wow, it's a lot. You know, you're doing a lot of extra work to make things safe. It gives you the opportunity to connect. It shows empathy, it shows kindness, and an understanding that these times are difficult for pretty much everyone. Find the common goal. Most of the time, that is maintaining or improving your health, but it could be something very specific to you. Be ready for the unexpected. Maybe there's a difficulty with the Wi-Fi, or your technology isn't working, or your battery is not working, or there's a lot of background noise. There's many, many things that can happen. Consider a real-time pivot. Have options, go to plan B or C or D. And if it's not going well and your frustration and your exhaustion is just overwhelming, just stop, ask for a reset, a do-over. Maybe that would be a post-visit, considering a video visit that might make it easier. You might be able to be in your home, or you could set up whatever accommodations you needed without time pressure. The provider might not be wearing a mask. It might be easier. So be flexible if possible and have alternatives. And finally, I would suggest that we all learn from each experience and then just move on to the next one. Just because it didn't work doesn't mean the next time isn't going to be good. It might be very good. So the most important thing is to take care of yourself and your health. And with that, I'm going to bring Carolyn on to talk about preparing your best communication and technology options.
Okay, thank you, Dr. Rennert. Hi, everybody. I am now going to talk a little bit about how you can start preparing yourself to ensure that you will have a good communication exchange during your medical visits. And this is relevant for in-person visits and more so virtual or televisits. So when it comes to communication with hearing loss or deafness, I like to think about the different visual assistance that can be used to help increase the amount of visual support and input that we can get to make sense of what's being communicated. And then there's a whole series of acoustic assistance that can be also utilized. I'm going to go into what that means shortly. And ultimately, you will get to know what works best for you. And maybe you already know that. And then there's some new tools that I'm going to bring up that I'd like you to consider trying. And every health visit will be a mix of these different visual and acoustic tools and technology that you can use to support the communication situation. So first I want to go over what visual support could you draw upon and teach your providers about what works for you. A lot of them will not know all of these very basic and sometimes more advanced options. So when it comes to visual, starting with very, very basic, it's really good to look at the lighting in the space or inquire in advance the lighting. If you're finding that it is too dark, maybe they could increase the lighting in the space. All of this will help you see the person communicating with you better, and that can help. In non-COVID time, we would recommend also decreasing the distance between two people so that you can hear them better and see them better. Of course, this may be a little more limited right now, but it is something that can be done. And written information is another way to get visual support. And so, okay, the captioning just stopped. Should I continue? Do you need me to pause at this point? Oh, okay, I'm seeing the captioning working on my end. Okay, so for written communication, there are lots of ways to do this. This is an example of a whiteboard that I purchased at a local office supply store, and with a white pen that can wipe off. And this is something you could bring with you. It's very lightweight. You could ask the doctor's office to have one ready and available for your appointment so that information can be easily written down. And of course, you can always use just a basic pen and paper. Always have that with you. You could ask for written follow-up instructions to be sent to you by email or mail, or even printed out before you leave. Captioning is another really valuable tool, even more so today, because there is now very high quality automated captioning available on smartphone apps. For example, I'll show you, this is my Android smartphone, and as I'm speaking, it is captioning in real time what I am saying. This particular app is called Google Live Transcribe, and there are other ones that are called Otter, Ava, Microsoft Translator. All of this will be in the follow-up communication that we will send to you by the end of the week. And if you haven't tried them already, we recommend that you give it a try. I highly recommend that you share that you want to use these apps in advance. Not everyone is familiar with them. Not every office will embrace them. Some doctor practices are not comfortable with the conversations because they're being transcribed, because they might be recorded. But so far, more of my physician appointments have been open to using it. So explore it. And you can also explore for televisits using a platform like Google Meet that has captioning embedded in it, as well as using relay telephone captioning services and video relay services for sign language to enhance the televisits or follow-up appointments by phone or video. And the companies that provide those services is also listed in the follow-up communication. And of course, using sign language interpreters or oral interpreters can be requested if you need that. When it comes to acoustic assistance, there are lots of things you can do. And one of the most basic things is to try to find a space that has a quiet background, no background music or TVs blaring. If you can move to a quieter space, that's great. Sometimes you can't, but then maybe you could ask them to make an adjustment just for a period of time. Using communication strategies can really help. There are some very basic things to ask the providers to do, and we have a tip sheet that we will be sending out as well that you can give to the providers. And some examples of this are to ask the provider to only speak with you once they have your attention, that you're looking at them and they're looking at you. You can ask them to slow down and articulate in between and pause in between different phrases so that you have a chance to process what's being said. And maybe there's just an agreement between the two of you that you may need more repeats than usual because of the mask, and it's just much more difficult. There are a lot of assistive devices, such as this one, for example, is called a Williams Sound Pocket Talker. This is something that the office could investigate purchasing, or you yourself have on for yourself. And it's a headset that you wear and the provider can speak into it. It works for certain hearing losses, but not every. So we recommend that you work with your audiologist to find out what is best for you and your particular hearing type. And then there are many hearing aids now that are Bluetooth enabled that allow you to stream the audio of a computer, a tablet, a smartphone directly into your devices. And this can greatly improve your ability to understand spoken language in conversation visits, televisits. And then there are many apps also that can be used to enhance audio, such as an app called Live Listen from Apple and Sound Amplifier from Google that can be loaded onto your phone, and then you can use your phone as an amplifier that will transmit the sound to either earbuds that you're wearing or directly to the hearing aids that you are wearing. And again, I recommend that you work with your audiologist to find out what works best for you and your equipment. So now I just want to give you two examples of how I applied a lot of Dr. Rennert's recommendations and the framework to recent medical visits. And the first one is an example that was very challenging. It did not go well. It was at an eye doctor appointment. I did not contact the offices in advance. I really thought I could handle it. I was not prepared for everyone on the staff wearing masks and PPE. I was taken to a room that was completely dark because I had to do 5 different tests on 5 different machines. So I completely underestimated the amount of communication that would take place, because before the pandemic, these types of visits were really not that much of an issue for me. And they were not aware of my hearing issue. I tried to explain it on the spot, but the person working with me wasn't fully understanding. I think, everyone's time pressured and really can't get off schedule at that point. So it was a tough visit. The doctor apologized when I let him know how difficult it was for me. He said that given everything they've had to do to change their practice to make it safe, he did not have the time or think through how he needed to accommodate his patients with hearing loss. So you really have to assume that people don't know that you need to be the educator and be gentle and enthusiastic about teaching them about the tools. He was so grateful to know about some of the apps that he can then help other patients going forward. So I took what I reflected on that visit, and I really had to make it better. So for the next one, I contacted this office 3 weeks in advance by phone. I explained my hearing loss. I explained I was concerned about not hearing well. They confirmed that I asked what will happen during the visit. They explained the doctor will have an N95 mask on with a screen, with a shield and full PPE. It would be very difficult for me to see the doctor's face and hear the doctor. So I explained some of my needs, and they said, just send a text message. Believe it or not, they said, send a text message to the office, which I did, explaining what my needs would be, different options. But I said, at the end of the day, I really don't know what's going to work because I've never been in your office before in this situation. And I asked them to just be flexible and that I would be flexible too. And they said it was okay to use the speech to text app as well. Once I got there, the staff was so ready for me. It was unbelievable. I received a text message on my phone before I arrived that gave me instructions on what to do. They said it was okay to enter the office and to go to the front desk. When I got to the front desk, they were ready for me. They had written out notes that are typed up on the slide that told me everything they needed me to do at that moment, like pay my copay, sit in a certain seat in the waiting room. When they approached me in the waiting room, they had a whiteboard ready with my name on it. And right away, I felt so much better. I felt calm because they knew and I knew that this was going to be a little more difficult than their typical patient. And everything went so much more smoother than I thought it could. It was okay that I didn't understand everything and that I needed them to repeat. And they also were consistently checking in with me. So it was just such a better visit. So I highly recommend that you give some of these suggestions a try. And it does take more time on our part, but it is worth it in the end. So now I'm going to have Dr. Rennert come back and join us for the last slide. Okay. Unmute yourself.
Unmute that. Okay. Thank you, Carolyn. Wow, what a lot of great suggestions that you gave. So to summarize what we've talked about, we created this checklist to try to improve effective communication during your medical visits. Number one, keep up with your health and wellness visits. It's really important. Know what works for you and also be open to trying new approaches. Prepare for your medical appointments. Consider what's going to happen before your visit, so a pre-visit, and as Carolyn detailed, trying to communicate with your team about what your needs are. Remember, the team is a large team. Ask who is best able to assist you. Sometimes that may be a practice manager. Sometimes it may be a medical assistant. But people in the office will know. Try to find an ally, somebody who is going to specifically help you at the point of care. Always have backup options. There are unexpected things will happen. Charge your equipment in advance, bring batteries. Believe me, I know it's a lot to carry, but it really does help. Remember, things don't always go as planned. It may be necessary to have a real-time pivot or to completely reset. Try to take a deep breath, acknowledge when things go right, learn from your experiences, and move on.
Thank you.
Thank you so much, Dr. Rennert and Carolyn. Those are really, really, really good tips. I actually think that the idea, Dr. Rennert, of the pre-visit and the visit and the post-visit is probably something from maybe these times that will continue. I can imagine it's really helpful for everybody, and it's kind of also what we're doing at CHC, but I guess it took a pandemic to figure this out. But I think that's a really, really good tip in general. We have a number of questions that we're going to address. The first question, is actually kind of an interesting one and a little bit of a twist than what we've been talking about. And Dr. Rennert, I think this would be best for you. The question is, I'm in charge of my family's health care and I have a hearing loss. Now with COVID restrictions, I'm often not allowed to go to the visit with my family. How do I handle this?
So this is a really common situation, and it can also be extremely frustrating because many of the system policies and laws will cover a person who has a disability, but they don't necessarily cover a family member who has a disability if the person who's the patient is either of adult age or doesn't have a disability. So this comes up a lot, and I just had this situation actually this week, and where I was seeing a patient, and she came by herself, and just really simple everyday situation. I said, okay, so let's make sure I have this correct. What medications are you taking? And she looked at me and said, whatever my husband puts on the table is what I take. So it was clear that they were working together, and that's a common situation. So what we decided to do, and the husband had a hearing loss. And so we talked to them and found that what was going to work for him was to do a virtual visit, a video visit, using our usual app that we use. So that's what we did. We brought him into the visit. Now, sometimes you can do that in the course of the visit, but it may also be a good idea to schedule time with the clinician or one of the team members for after the visit to review all of those things. And there's a lot of technology that you can bring in. You can bring in a relay system, you can bring in speech to text, you can bring in visuals. So the idea then would be to include that person with whatever technology is helpful to them without them actually physically being present.
Thank you. Those are really good tips. And the next question that actually came in, and I'm glad we have her on standby, is our Director of Audiology, Dr. Ellen Lafargue, has been here and listening in case a question came in, and we do have one question. Hi. Question came in about, is there anything that I can do to optimize my hearing devices, whatever they may be, specifically with masks and social distancing, so that I could hear better?
So we've been dealing with this a lot over the last couple of months, and it depends on, well, the answer is it depends. So it depends on what kind of hearing aids you're wearing and what kind of devices you're using. Many hearing aids now have the capability of having multiple programs in them. And we have found that by creating an extra program specifically for when listening to people who are wearing masks, many times a little bit of extra high frequencies or high pitches will help, a little bit of extra power, a little bit extra gain will help. So this may or may not be able to be done remotely with your audiologist. You really need to communicate with your audiologist, say, this is what my problems are, how amenable are my hearing devices for these kinds of changes. And we've been able to create this for probably 75% of the people that ask for it.
Thanks a lot, Ellen. Another question came in, and I think that we've been asked that a lot and have been contemplating a webinar on this topic, so maybe we do need to do it. A question came in about, what can we really ask from our provider, and what are we really entitled to under the ADA? Is there anything that we're not entitled to? And maybe Carolyn, I don't know if you want to address that. It's a topic in and of itself, but maybe there's a quick answer to help.
Sure. I think you really need to think about what does it take so that you can get the quality of communication that you need to ensure optimal healthcare, and that it's the equivalent of what someone who doesn't have a hearing loss would experience. Basically, no barriers. So I think you need to ask within reason what they can do for you. The ADA does spell out certain tools and strategies and tips, even communication strategies, certain technologies. A lot of what we covered today, you're entitled to ask for. So I would be confident in exploring it. It really focused on the partnership and the, making it a two-way collaboration. You would be surprised. They might have some creative suggestions that you had not even thought about.
Good point. Thank you. Dr. Lafargue, this is actually perhaps a question for you. Somebody asked if the doctor's office had a loop system, if the client was fortunate enough that it was there, would that help in some of these situations?
It very likely would, because the loop system would be attached to a microphone that would then feed the sound directly into your hearing aid. So almost for sure it would make it better. Not perfect, but better.
Okay, thanks. A question just came in, Dr. Rennert, that I think is appropriate more for you. And there are sort of two questions that came in that are kind of related to masks. One is, and I'll ask them both together and then you can answer them. One is, somebody said that they understand that they can ask a provider to remove their mask. And then another question is, what about medical professionals wearing clear masks that are appropriate for medical providers? And are there some out there? And I think the issue about can you ask a provider to remove a mask, I think you would have insight to that.
Sure. Yeah, I mean, I'll take those two questions together. My understanding and my personal view is that it's not a good idea for either the patient or the physician or clinician to wear a mask. In fact, we have these signs all over, and actually it comes in backwards, I guess, but what it says is, for your safety and ours, please do not remove your mask while talking. So I do never recommend removing the mask. I think that sometimes that's the first response from people, because they understand that, the person may want to lip read or see expressions, but I think it poses an additional risk. So I never recommend that. As far as clear masks, so there are a number of them that are on the market, but even the one or two that are FDA cleared are what we call surgical grade. So they are the equivalent of masks that would be used for procedures or for surgeries. They're not N95 respirators. They should not be used alone when there's a known exposure to a respiratory pathogen such as COVID. So the masks, and I did show them before, I'll bring them back. There's a couple of different ones here. So this is one that's called Safe and Clear. And this one is just called Clear Mask. There's a number of other ones that are on the market. They are not easy to get, but they have waiting lists of about a few weeks, maybe a month. But I think the key thing is that what I think all of us are doing as healthcare providers is assessing the risk in the situation. And sometimes that becomes a personal issue. So some people would prefer to wear an N95 mask, for example. And these clear masks are not going to provide that level of protection. Or they may require it because of how close they need to get to the patient or what procedure they're doing. So I think that they're helpful, and they can be used. I'll tell you what I do is I bring my mask to every medical visit that I go to. I wear it around the hospital. I use it when I see patients. I give it to my team. I teach a lot, so I give it to my residents, my students, just to essentially promote awareness. And people really like it, even if they don't necessarily need to use it for hearing loss, because you can see people smile. And I call that my smile mask. So, so that's what we do. They are available. But again, going back to the first question, I never would recommend removing a mask.
Thank you very much. And I also appreciate the fact that it is a two-way street. Everybody's in this together, and I think that everybody, I mean, certainly we at CHC want effective communication, but everybody also needs to be safe during these times. And it's just a complicated issue. Carolyn, a question came in that I think you would probably be best to answer. Somebody asked about the speech-to-text apps in general. Do you hold the phone up for the provider to see, or do you ask a doctor or provider to download the app? What's worked for you?
That's a great question. I think it's always best to bring your own smartphone with your apps loaded and get familiar with them before you arrive so that you're not fumbling around and that you're comfortable using it. However, I think it's really courteous to ask the practice if they would like to use their own device. Maybe they just feel better about having the communication on their device. So maybe just have that understanding. So I hope that answers the question. And then the other question was, do you hold it? How do you hold it? So what I wanted to recommend was, you have to remember this is automated captioning generated by intelligent capability, artificial intelligence. So it's really important to make sure that the clinician and the health provider you're working with is reviewing what the speech-to-text app is showing on the screen. There's a chance it may populate one word that's not correct, and it will then leave you misunderstanding unintentionally what was being said, or maybe a specific medication doesn't come out correctly, and then you may leave thinking you have to get one thing and it's not correct. So make sure that it's thoroughly reviewed, and if it's not coming out correctly and the doctor has said it 3 or 4 times, then just have them write it down on a piece of paper.
Mhm.
Great.
Go ahead,
Dr. Rennert, do you have something to add?
Yeah, I wanted to add to that, my suggestion, like Carolyn said, is to try to become familiar with a number of speech-to-text apps. And the reason for that is that you may run up against some resistance for using certain ones based on security for your protected health information. And those that allow recording, keeping a document are sometimes concerning because that could be altered or forwarded. And so I recommend that in addition to some of the commercial applications, that you also consider using relay systems or other systems that are provided by the government, which are thought to be more secure, so that your provider has those options.
Thank you very much for that. We are really now we are out of time for today. There's a few questions that we haven't been able to get to, and we can look at them, and in the follow-up email, we should be able to answer some of these and give you a lot of the information. Really want to thank Dr. Rennert, Carolyn Stern, and Dr. Lafargue for their time. And on the last slide, we'll have some of our contact information on how you can reach out to all of us in case you have more questions, which we are happy to address. Stay tuned. We're planning to have more webinars on this and similar topics. Thank you for joining us tonight. Have a really good night and stay safe.